Governor Cuomo just addressing questions of a cover-up about nursing home deaths. He said that all deaths were accurately reported, and he also acknowledged information was not provided to the legislature, the press, and the public at times during the pandemic. Let's get to Chief Investigative Reporter Jonathan Dienst in the newsroom monitoring the latest. John.
Natalie, Governor Cuomo acknowledged mistakes, and he took responsibility for a delay in providing important information to the public and families of those in nursing homes. The governor says there's no scandal, there's no need for an investigation. He says his office told the legislature that information on nursing home deaths would be delayed in release because the health department was busy trying to answer a separate request from the Trump Justice Department. Cuomo says all COVID deaths were reported accurately, even though the state attorney general and Democrats and Republicans in Albany continue to question if the governor's office underreported nursing home deaths. Cuomo did acknowledge today his office's failure to provide timely information that left a vacuum for rumors to start.
We didn't provide all the information that was requested. That did create a void, and misinformation did fill the void. And that misinformation gave people aggravation and confused people who lost a loved one.
Some Republican leaders in Albany today continue to use the phrase Cuomo lied and people died. They're demanding an investigation into the reasons nursing home data was not released sooner to legislators and the public. Cuomo today said patients from hospitals sent back to nursing homes were not the cause of outbreaks. He said workers and visitors early on likely more responsible for that spread. In the newsroom, Jonathan Dienst, News 4.
Jonathan, thank you. And at that briefing, the governor also breaking some news along with the MTA about the subways. The agency has announced it is cutting the number of hours that the subway is shut overnight. So starting next Monday, the subways will only be closed from 2 to 4 a.m. instead of 1 to 5 a.m. The MTA says it's ready to ramp up service because of the lower COVID numbers and the need to service late-night workers.
With the deployment of the vaccine, a drop in the infection rate, the resumption of indoor dining, extended hours for bars and restaurants, and the reopening of stadia and arenas.
The MTA says it will still be able to adequately clean and disinfect the subways during the new 2-hour shutdown period.
And new at 4, the more contagious South African strain of the virus is now in New York City for the first time. But the patient lives in Fairfield County, Connecticut. Now, that person tested positive after they were transferred from Connecticut directly to a city hospital. Governor Cuomo says there's no evidence of spread in New York, though. The patient is between the ages of 60 and 70 and has not traveled recently. Dave.
Natalie, more now in the race to vaccinate New Yorkers. Millions more New Yorkers are now eligible for the COVID-19 vaccine. Starting today, anyone between the ages of 16 and 64 with an underlying condition can make an appointment, and that includes people with cancer, kidney disease, heart disease, and pregnant women. Also includes 9/11 survivors and first responders. And just today, the city opened another mega vaccination site, this time at the Aqueduct Racetrack in Queens.
I couldn't wait to get here. This virus is real, and we must take it seriously.
Yeah, it's been a year, and it's hard. It's very hard. You know, I have a new grandchild. He's 4 months old, and I've never touched him yet.
For those who qualify with pre-existing conditions, you will need a doctor's note, medical record, or signed certification. Officials say new appointments will be released on a rolling basis over the coming weeks.